Good afternoon, everybody. This is the Sauk County Coronavirus Update. So what you will be hearing is local COVID-19 response updates and information as of December 3rd, 2020. Joining in this call are Jody Molitor, the Sauk County Health Department Preparedness Coordinator, Jesse Phelan, our Nursing Manager, and Siobhan Allen, who is handling our data and informatics. So take it away, ladies.
All right, this is Jody. Thank you everyone for joining us again. I'm just going to do a little reminder and update on testing. We do have testing available 4 days at a minimum throughout our county. We also have a date coming up this Monday, the 7th, happening in Laval at the Laval Town Hall. We are working in conjunction with the National Guard to provide testing from 9 a.m. to 4 p.m. If you are interested in being tested, you can register ahead of time by going to register.covidconnect.wi.gov, and they will, it'll walk you through the steps, and it's very simple to sign up. And then when you come to be tested on Monday, it's a quick and easy process. So you've been tested for COVID. What are the next steps that you need to follow? The first thing and the most important thing is we want you to stay at home while you wait for your test results. That means limiting all of your non-essential travels unless you're driving through to pick up food or medicines or other essentials. Be sure to be keeping yourself and others safe. Always wear a mask around other people, clean your high-touch surfaces, wash your hands, and always watch your distance. If you are not feeling well or are sick, stay in a room away from other people. Rest and drink lots of fluids and watch yourself for any symptoms. Please remember that now test results, we are asking you, or we are telling you that they can take up to 7 days to get back. The quickest way to receive your results is to provide a valid email when you are registering at that email address that I just shared. Test results will then be sent to your email as soon as they are processed in the lab. So that, again, that is the quickest way, is to use a valid email when registering. Positive results will also receive a follow-up phone call from public health. If you don't have an email, excuse me, or you could not open your email or didn't receive your email after 7 days, we do ask that you call Sauk County Public Health, and that number is 608-355-3290, and you're going to push number 3, and that is going to allow you to leave a message, and one of our Sauk County personnel will give you a call back as soon as they are able to, and let you know if we have your results or not. And with that, I will turn it over to next on the list. I believe it is Jesse Phelan.
Thank you. Just wanted to talk a little bit about vaccines for COVID-19. We are still in the infancy of learning what that's going to look like for the community at large. We have been in conversations with the Department of Health Services and learning about what that rollout will look like. And the first group to receive vaccinations will be certain healthcare workers, and it will go on from there. We are still waiting to learn more about who will be allotted what vaccine and when. And again, that is still pending FDA approval for the use of vaccine, which is slated to be up for review next week. So as we learn more information, we will disseminate that to you all going forward. And then just to tag on to that, I think a lot of you have heard that there has been a little bit of a potential change coming from the CDC regarding quarantine guidelines. Yesterday, the CDC published options to reduce quarantine for close contacts. Wisconsin Department of Health Services is currently reviewing this information and will be formulating Wisconsin's recommendations. Until this happens, the current recommendation for close contacts is to quarantine for a full 14 days and remain in place. So we will update you as we get more information from the Department of Health Services for Wisconsin's response to this new information.
Thank you, Jesse. Was there any other updates from anybody before I move on to the data update? Okay, we will move on to the data. Give me a couple seconds here to switch which screens are being shared. So today, Thursday, December 3rd, our cumulative case count of people that have had COVID infections in Sauk County is 3,689. Today, 765 of those cases are currently active. So the doubling time in Sauk County has now increased to 35 days. We like to see that doubling time increasing. Last week, Thursday, it was 30 days. So really liking that change in our case counts. Total of 130 Sauk County residents have been hospitalized for COVID-19, and unfortunately 19 Sauk County residents have lost their lives to this virus. Looking over to the data hub, a couple of these charts have been updated, so you can see on this particular graph, this is our cumulative case count. You can click the tabs up here to see our new cases by date confirmed, and this has the green line is our 7-day average. So you can see now that we have dipped below this critically high case activity level. So in the last 14 days, our average number of cases has been below this level. And so we actually have, as you see when we scroll down a little bit more, we have left the critically high case activity level. We are still in the very high case activity level, which is not exactly where we want to be. We want to actually be below this line here. So we still have a ways to go to keep this line moving further and further down. The other chart that is on this particular section is our deaths. So you can see how it remained steady for a very long time and has unfortunately increased this fall and into the winter here. We also have here our Sauk County hospital charts. So on this chart, you can see the number of people that are hospitalized in Sauk County for COVID. So the first chart is the COVID inpatients, and the second chart is the COVID patients in the ICU. And please be patient with the data hub. It will take you some time to load. And these charts, they're kind of big, so best viewed on a desktop, and please be patient with it. So you can see each day the number of COVID patients and COVID ICU patients in Sauk County hospitals. This is the only chart on the data hub that may include information that is not of a Sauk County resident. So a Sauk County resident may be hospitalized at a different hospital, and so they would not be counted on this chart. And a non-Sauk County resident may be hospitalized in Sauk County, and they would be counted on this chart. So just a little caveat about the hospital data, that it may not include all Sauk County residents that are hospitalized, and it may also include non-Sauk County residents that are hospitalized here in our county. There's been a couple of slight changes to the zip code or the census tract map. So Wisconsin DHS has released yesterday additional maps that break down confirmed COVID cases and deaths by new geographic boundaries. So the state does now have a zip code map. If you click this link here, it will open up and you can navigate it. I'm just going to give you a really quick overview of this map so that you can see the differences. The one that I am keeping on the data hub is the county and census tract map. So that's the same as it was before. Double click to zoom on in, and it will tell you the cumulative confirmed cases in that census tract. If you click the link to move over to the state's website, there are the tabs up top here. So this will give you the county and census tract. It can break down to city, village, and town. Can break down to school district, and also zip code. Once you pick one of these, we'll pick the zip code one since that is most frequently asked for. That map will load, and you'll see that there are along the bottom additional tabs. So the default one is the cases and 7-day average rates. So if you double click to zoom in, and again, please be patient with these maps because they do take a while to load. So you can double click further in. you can see the zip code areas. So for example, we will pick the Reedsburg zip code just to have it displayed. The default will give you the cases and the 7-day average rates for this zip code. Now, if you look, the darker shaded areas have higher case rates than the lighter shaded areas. It can be a little bit confusing for that case rate number. So what might be the easiest to understand and the most similar to the zip code map that we used to have on the Sauk County Data Hub is if you use this cases cumulative counts tab. And then you can double click on in, and this will give you the total number of cases in a zip code since 3/15, so since the start of the pandemic. So if you click in, then you can see that there's been 781 cases in the 53959 zip code here. So this is probably the most familiar, most similar to what you guys had all previously seen when we had the zip code map on the Data Hub. There are additional tabs where you can see the cumulative death rates, the cumulative death counts, and the percent of deaths by percent of cases for each of these individual areas. So play around on this map and you can kind of see some more information there. Going back to our Data Hub, the case demographic information has been updated of the ages of confirmed cases, the ages of those ever hospitalized, and upon request, we have modified the age of the COVID-19 deaths. So that is now broken down by the number of deaths by age groups. So you can scroll over there and see the number of deaths by those age groups. The case severity is still on here. We're continuing to see the moderate case severity increase. So this really has taken a jump in the past 3-4 weeks here. It used to be about a quarter were moderate, and now we're up over 30%. And so moderate cases are those people that had symptoms that were concerning enough that they sought medical care and they received outpatient medical care. Our mild cases continue to be about that 50 to 55%. Our asymptomatic continue to decrease. So remember, over the summer, this was much higher. Now it's down to about 7% of cases. And then our severe cases, these are the cases that are hospitalized and or the cases that ultimately lose their lives due to COVID, is staying steady at about that 4% of cases. There's the demographic information for you to look at as well. And then when we look at our status, so these are our 14-day metrics. There's been a couple of changes in our metrics this week. So the notable changes is that our influenza-like activity has moved from the yellow to the green. And we can look down and see some more information on that. The other notable change on this particular map, you will see that Sauk County is now a very high case activity, so has moved down from the critically high. Now again, any of the case activity levels that's high, very high, or critically high, we're going to consider that a red status. So yes, we've moved down from the critically high case activity level, but we're still in the very high, which is not where we want to be. Some of our other metrics are percent positivity. And again, remember, you can navigate this map by selecting the county and then selecting the activity indicator. So our percent positivity is below 10%, which puts us in that medium level. So that's why that metric is in the yellow. This state map displays the percent positivity over the past 7 days. We do calculate it out down here for you for the last 14 days to be more consistent with all of the other 14-day data. So if you hover over, you can see that our 14-day average percent positive of tests was 9.1%. Our COVID-like illness activity has been pretty steady. We have a high burden for our number of people that are going to Sauk County emergency departments with COVID-like illness. Our influenza-like illness dropped down. So in the last 14-day period, we only had 0.4% of our emergency department visits were for influenza-like illness compared to that normal range of 0.7 to 1.3. Our new case rate per 10,000 in the last 14-day period was 94.76. We had 594 new cases. So you can see our cases per day. You will notice that there is a day where there was 0. That was due to Thanksgiving holiday. So when you look at these particular charts, that's where looking at the 7-day average really helps. That 7-day average line, again, is up on this chart way up at the top so that you can see those averages over time for the cases here, which kind of then smooths out that gap where there were not any cases that the data was entered into WEDS on that Thanksgiving holiday. I'll pop back down here. Our testing numbers. So our tests conducted. We did do slightly less testing over the last 14 days. So our total tests that were conducted in the 14-day period was 6,950. It was about 500 less tests than the previous 14-day period. So again, when you're kind of reviewing everything, realize that maybe part of our decline in new cases was in a reduction in testing due to the Thanksgiving holiday. Also, our timeliness of lab reporting continues to be in the red. It is unfortunately taking the labs longer to get test results back. So like Jody had said, for our testing status, it is taking up to 7 days to get those test results back. So if you are tested, expect that it might take a little bit longer than it previously has to get those test results back. Our timeliness of disease investigation, again, because with the increase in cases that have happened since October and November, our Sauk County Public Health staff are no longer able to contact every positive case and complete a disease investigation interview. So if you were tested by your healthcare provider will be calling you with your test results. If you were tested at a community test site, then Sauk County Public Health will be calling you with those test results. So even with our increased caseload, our staff were able to contact 64% of new cases in the last 14 days to complete that disease investigation interview. So yes, it's in the red, but we are almost up into the yellow for that particular metric. So thanks again to all the work of our public health nurses and our disease investigation staff that are working really, really hard to contact those people that are positive and make sure that they're able to isolate so that we can reduce the spread of this virus. And then the last metric that we track is the community spread. So of those with completed interviews, unfortunately, 45% were not connected to a known source case, so they didn't know where they could have gotten COVID, which means that there are cases out in the community that we do not know of. So that metric remains very firmly in the red. So a couple of other notes about the data, and we will hop up to this chart here. So as we're seeing this decrease, this green line moving down really over the past 3 weeks, that's been a pretty steady decrease. We really do want to see that continue. We are probably not going to know yet. I've had people ask me already, are we starting to see an increase in cases from the Thanksgiving holiday? And we're probably not going to see that until middle of next week, possibly the week after. And this is for a couple of reasons. It takes time for when someone is exposed to when they first start showing symptoms. It takes time for that person to get tested. And then it is taking that up to 7 or more days for the lab result to get that test back. So we may not see any increase from the Thanksgiving holiday for another week and a half, 2 weeks even. So hopefully we continue to see this green line going down and can get it even down below this level of average of 5 cases per day. That would get us out of the high case activity levels. In order for us to continue to keep this line going down to reduce the number of new cases per day, we're really depending on everybody to continue those COVID preventive practices. So that's wearing your mask when you're out in public. It's staying home as much as you possibly can. It's maintaining that 6-foot distance from anybody that is not in your household. It's washing your hands frequently and disinfecting those commonly touched surfaces. So it's all of these practices that we really need to continue through the holiday season to keep this new case rate going down so that we can get this virus more under control and reduce the number of people that are infected. And hopefully we can turn these hospitalization rates and these death rates back down. So that's our data update for today. We did receive one question this week. And the question that we got was, when is the best time to get tested after exposure?
So current recommendations for getting tested after COVID-19 exposure would be about 5 to 7 days after that exposure. Unless you develop symptoms before that, then you should get tested at that time. The current recommendations are still to remain in quarantine for 14 days after that exposure. If that guidance changed, as we previously discussed, we will be letting you all know that as soon as we have that information.
All right, thank you, Jesse. And if anybody has any questions that they would like us to answer on a future one of these recorded calls, the email address to send that question to is covid19@saukcountywi.gov. And anybody have anything else to add for this week's recording?
I'd just like to thank everybody for tuning in to these updates. Please, everyone, until we speak to you again, stay safe and well.